Greetings, everybody. This is Faiz Jacobs, Member of Parliament of Athlone. This has been a while, but it's part of the normal people and politics podcast that I have. And with me today is Honorable Dr. Kenneth Jacobs, my fellow counterpart in in Parliament. And Dr. Kenneth Jacobs is also the chairperson of the Portfolio Committee of Health in the National Assembly. Thank you, Dr. Kenny, for making time today on this cold morning. How are you doing?
Good morning, Faiz. Thank you very much. I'm good. Good. Yourself?
All good, all good. So today we're going to talk a bit about the National Health Insurance Bill or Act. I know you've been from the beginning, and to this week we've just passed the bill. So maybe just as a start, as an introduction, take us through the National Health Insurance Bill Act, whatever it's called, and explain why is this significant for us as a country.
Let me take you back to 2007 when there was a resolution taken by the ANC at its national conference that we needed a health insurance system that would allow all people to have access to quality health care in South Africa. So since then, there have been attempts to get this resolution passed or worked with or improved or taken forward by both the ANC but also the National Department of Health. And really it is because there is a need for everybody to have access in South Africa, to have access to quality health care. It is clear that the poorer people, those of less means than rich people, do not have access to good health care, and it's not easily available. It is not within their reach very easily to access healthcare, and you would know that everybody's lives would depend on the access to good healthcare that is good quality, that is affordable, and where people can feel safe that when they do reach out to receive this healthcare, that they're able to receive it. And so there is a real need for this bill or for this act, and there is a real need for this fund that is actually the NHI to be structured and for this bill to be passed by Parliament.
Right. I think the one thing that I wanted to ask, maybe just pointed questions. So we started this journey some time back. I wanted to share the booklet that I've put on. So let's start with the simple things first. Where does this NHI come from, and what countries have actually implemented this? So I'll ask pointed questions, and maybe you can just respond to it in a pointed way.
Yeah, so it's all about universal health care. Universal means everybody has access wherever they find themselves to all kinds of health care. And many countries have enacted this universal health care, for example, Sweden, Germany, England, New Zealand, Australia, meaning that people can access the health care. Taiwan and Brazil and many other countries. United States now recently with Obamacare. So there is an acceptance that there needs to be a different healthcare system to provide this access to healthcare.
So it has been implemented, and there's a lot of doomsayers that say, yeah, we can't afford it. Yeah, the system, we can't even look after the public health now. So how do we deal with the criticism that is there?
An interview the other day with a lady from Rapport, and she was saying exactly the same thing. When you're in a particular position in life, you would have blinkers on which make you think that that is the way that you ought to look at life. You purport that to be the truth, and you find that those who say these things are those who are in a better position with regards to means to be able to access. But you have on the other hand other people who don't have that means, and they would have a completely different view. as to the challenge which people have. And the NHI, as I said earlier, is really a fund where we pool all of the funds of the country into one funding system, one funding mechanism, and there's a single buyer, single payer of services, and would in that way bring about equity in the distribution of healthcare services.
Right. So, I mean, I've just put up this this brochure and I'm sharing it. It says, what is NHI? The difference, the health insurance will cover by every South Africa, whether you're employed or not, whether you're high income or not. Economic status will no longer be influenced the type of health care that you'll get. So, I mean, during COVID, we've seen the importance of health, that that if you don't have, your health could be compromised. So this is the reason why universal access to health is important. How are we going to, what's the modalities, how it's going to work? Give us the time frames. So for example, if I'm someone in my constituency in Athlone, I'm not working currently, I know there's a clinic close by, I have access to basic healthcare, which is already covered. The service is not that great. We have to wait long. And now you go side by someone who's actually working and say, I'm cross-subsidizing someone else. How is this going to work? And also give us the time frames.
Well, it's all about, firstly, what the Constitution says, that people have the right to access quality healthcare. That's the first thing. The second thing is this thing called social solidarity, which you're speaking about, where we say that there are people who do have more money, there are people who earn money, and they're unemployed. And that we should all, as South Africans, come together around this point of social solidarity, that we are willing. And if we're not willing, at least that we're able to, through whichever system or mechanism that is put in place, to assist other people, whether the rich assist with the poor, the young with cross-subsidization of the elderly. But there will always be people in need and who really cannot afford. So, you know, so social solidarity is really the center of all of this.
Right. I mean, here's some 10 reasons why NHI is good for the country. Our budget health keeps increasing, and our network of public health must still grow. And we need to ensure that rural communities also get the same care. Some areas in major cities rely on overcrowded public health with few professionals and poor equipment. The amount spent on healthcare for each person with medical aid is 5 times that of the amount that rely on the public sector. Standard of health care is big between the rich and the poor. 8 out of 10 patients in South Africa use public facilities. The two-tier system of paying for healthcare is guaranteeing poor healthcare across. Citizens deserve better, and there's also argument that NHI will reduce the cost of private health. Quality in care will continuously deteriorate if we don't do NHI, and the increase of out-of-pocket payments of disposable income is going to be skyrocketing. So these are some of the benefits. Do you just want to comment on these 10 reasons and maybe comment and add on it, please?
Yeah, if you could just scroll down a bit, maybe I'll take them one by one very shortly.
Okay.
So, you know, in terms of the health budget, the population is growing very rapidly. It stands to reason that the health budget would have to increase. Currently, the health budget is not really increasing because there are budgetary constraints. But the number of people in South Africa are just growing much more rapidly. We've been trying to build new facilities, especially primary healthcare facilities. And you know that care at primary healthcare level is free of charge, and people are able to access this, but we just don't have enough primary healthcare facilities. But your basic care does not end with primary healthcare. Oftentimes, one needs referral to other facilities like your secondary hospitals, your regional hospitals, or even your tertiary hospitals for more healthcare. And that's where the dilemma comes in. That those who do have medical aid can access this, and those who don't must sit in long queues, struggle with emergency services to take them to or transport them to hospitals, sit in the queues or wait for hours on end to get the necessary care which they require. And I think it's purely a function of funds because of the maldistribution of funds in the private healthcare and in the public healthcare sectors. And at some stage, with the cost of private healthcare, at some stage, there would have to be an intervention, which would then either bring the cost down of private healthcare or improve the healthcare that is provided to all people, especially in the public healthcare sector. So the NHI really is saying, we will make use of the private healthcare, we will make use of the public healthcare, but we're going to pool the contribution of funds into one fund, and where we will allow all healthcare service providers to register and to be accredited with the fund in order for them to be able to provide services to the people who really require it. So all of it together really is true what is stated in those 10 points. And you and I know when you go by this time of year, you find that you don't have enough medical aid funds left, and you'd have to now what we do, pay out of pocket, or even when you have to find certain medications, you have to pay out of pocket top-up cover.
Okay, so I think the next, we now understand the rationale and why it makes sense for all of us. So the solidarity where we work together. How will it work? Who will pay for NHI? How will the taxes be collected? Just take us through that.
Well, currently, people contribute to the coffers of government through paying taxes. And then, as we know, there is then an appropriation bill, an appropriation or a distribution by National Treasury of funds through the budget vote, which the Minister of Finance then brings, and he says that education must get so much and health must get so much. But in the end, you really only have a purse full of a certain amount of money. You have to distribute out of the purse which you do have. We're now saying that take all of these funds, which is in the private health sector, and the funds which are in the public health sector, put it into one purse, and it would be twice what we currently have within the public health sector. You have so much more to use for the benefit of all of the people. I think it's basic economics in that sense that says we don't have enough. We need to have more. Where do we get more from? So people generally, in terms of their taxes, in VAT, in fuel levies, in surcharges, in voluntary contributions, in tax rebates, which people receive, which currently the people get that personally. We're saying that those should really go to funding of healthcare. And so there are many ways in which funds can really be generated to government as contributions from those who contribute to the coffers.
Okay, Dr. Jacobs, just like concretely, will there be like a health tax for all of us? Will there be medical aid? So if I work and when this thing is being implemented, currently I pay maybe 3,000-4,000 rand for medical aid, and it's being deducted from my employer, and for that I get the basic cover for this medical aid scheme. What will happen to me now? Will when it kicks in, do I pay that money into a national health cover, or how does it work, like very concretely?
Well, we're looking at payroll taxes and we're looking at surcharges. So currently, medical aids will continue to exist until NHI is fully implemented. So you will continue with that. And then medical aids will only be allowed to provide top-up cover. So in terms of generation of the funds, it would be in the same way that people would be paying a certain amount depending on their income level. And it means the more that you earn, the more you're going to be contributing to that NHI fund. And so it doesn't mean that medical aid funds goes now to the public health sector, or money that people had been paying to the medical aid. It's going to be a standard percentage of income, which contributes to the provision of healthcare through the NHI fund.
Okay, so that details is not yet there. So we've passed the bill now in Parliament, and it's going to the National Council of Province, and then the president's going to sign it. And then what is the next steps? I mean, when are you looking at piloting? When are we looking at implementation? What's the phases around it in NHI?
The next step now is it has to be forwarded to the National Council of Provinces, who will go through the same process. I don't think it would be such a rigorous one as the one that we've had. It had taken us quite a while to do the public hearings, 3 to 4 districts per province, all 9 provinces, and then getting all of the written submissions, oral submissions, and via SMS and email submissions, etc. And we've had to really draw up reports, interrogate the submissions and the public hearings, what people had been saying at those, and that had been a very long, difficult process, but we are now past that process. National Council of Provinces, of course, will do something similar. I'm not certain at this stage which districts they would do, because you'd understand that they actually really represent the provinces at the NCOP. And the steps after that would be then for this bill to come back to National Assembly for us to look at whether they had made any amendments to the bill, whether they had agreed with the bill. And that in itself is a very short process. And then upon adoption, it is forwarded to the president for him to assent to the bill. Then the real work starts. So currently there is a bit of work because there had been funds allocated to the NHI program at National Department of Health to implement or to look at certain things. For example, the employment of certain people who could contribute to the further development of the program for NHI. But then really it's going to take some time. We've had to change the timelines, which you asked about earlier, because we said that it would have to have implementation by 2020, start with implementation by 2022, be completed by 2026. And we're now at 2023. So we've moved those on. And then, so depending on the process of the NCOP and the president signing off on it or assenting to it, it would really be up to the National Department of Health to see how quickly they'd be able to move this forward in terms of implementation. I don't want to give a timeline because I don't think we can suck that out of our thumb yet, but the National Department of Health will be able to give an indication. Are you there, Faiz?
Right. So look, we've made significant progress. It's not a mean feat for you guys. Are you there? It's not a mean feat for us to go through the submissions that we got. And are we getting a lot of resistance, or just from your own provincial road shows and feedback? Is South Africans getting ready for this? Are we getting our mindset ready to share and to show solidarity? What's the level been of conversion from those in the private health? And the criticism is that our public health is not being managed properly. There's a lot of corruption. We don't have competent people in the place. Our health workers are either underpaid or overworked, or they don't just care. And we see horror stories in our public health. How are we going to ensure that we get the basics right? So when this acts and frameworks is in place, that we can give confidence and build that trust, which is, there's a big trust deficit in the country. It's not only amongst opposition. I think there's a general sense that we can improve our health management, especially in the public sector. How do you respond to some of these criticism?
Well, again, it depends on which side of the fence you are. But firstly, we do have a lot of difficulties with healthcare service provision. We have to acknowledge it. We have been doing some oversight. We've seen infrastructure which really should not be facilities where services are provided. We have seen that with the cholera outbreak, for example, that water is an integral part of the supply of clean, good quality water. Is an integral part in the provision of healthcare services because we use it for so many other things. We know that there just are not enough posts for the doctors because posts are frozen, especially senior posts are frozen. And in medicine, there's a hierarchy of that a very required and a correct thing, a hierarchy of employment of doctors. Your most senior doctors are always involved in the training of the younger doctors because of the nature of what we do. And when you don't have those posts available for the senior doctors, you're also not going to have good quality doctors coming through the system with the training at a lower level of functioning, for example, your interns and your ComServes and your early medical officers, etc. We have to be realistic that those challenges are there. It would be foolish not to acknowledge those challenges. As far as funding is concerned, we find that with many provinces, when they receive their budget, they have such a large amount of money outstanding from the previous years, which are called payables and accruals, that when they receive the budget, really they have something like 30% or 50% of the budget left to be able to take services forward. So those challenges do exist. Where they come from is also very difficult to say because it's been over a long period of time, us in any case having inherited a system that did not allow for all of the people of South Africa to be able to access healthcare. And it would have been, it's a simple mathematics that when people are added to a system and a large number of people are added to a system which was never in place for them, in any case, that there would be the constraints which we have now. It would stand to reason that these challenges would have developed. The question is, what do we do now in order to improve the system? And I think centered to that is the availability of funds to assist with the improvements which are required.
Thank you. I think we're going to conclude. I think for me, if we can just talk a bit about what is the key takeaway messages that you want people to know. I think this government is talking about basic universal health coverage. We're talking about lifestyles. We're talking about health is the new wealth. And we need to ensure that we have a healthy, productive population. What, as a doctor and also as a medical practitioner, what is the key takeaways that you want, or concluding remarks that you want people to take away from the Act? And also, how do you break away from this fake news or this scaremongering tactics, where the very people that needs the national health insurance are the very people that is maybe averse or getting drawn in with this fake news? Just your concluding remarks around some of those comments.
Thanks, Faiz. I think firstly, everybody must know that you are responsible for your own health. You want us to be proactive, be preventative, understand what your body is all about, how it functions, and then you have to take responsibility. And that responsibility means you must go to the place when you're not well to go and seek help. And then in terms of the Constitution, it is then the government's duty to ensure that you are able to then access that healthcare when you need that healthcare. So I think it starts with I'm repeating this, but it starts with each and every one of us to stay healthy, and so that allows us to be economically active, to be able to take care of ourselves and take care of our families. For the people who have all of these negative comments, you know, it is strange that some come from the same difficult backgrounds, but once they've moved on, they seem to forget that there are other people who are in those difficult backgrounds and who are having those struggles. Then are those who have never had those struggles. They don't have a sense of what it really must be like or feel like to be a person who cannot even get him or herself to that facility because it is 10 kilometers or 20 kilometers away, and they must find means to get themselves in a very sick condition to get themselves to that facility. So it's really those who have those comments really do not have a sense of the social solidarity which they must have with all people of South Africa, especially those who have more a better family economics or a personal economic situation than those who have absolutely nothing. You look at the weather now, you look at the rain and the floods, and really it must be very difficult for the people who don't have access to anything to find hope in having a better life, unless it is provided for by those who are able to do that, including government.
Thank you. That was Dr. Kenny Jacobs, the chairperson of the Portfolio Committee of Health. We spoke about the NHI, the National Health Insurance, the bill that was just passed in Parliament about a week ago. We are very proud of it. As the ANC-led government, we think it's a very caring, responsive piece of legislation. Yes, there's still work to be done. We want to thank Dr. Kenny and the team for their diligent work. I mean, to go around to all the 9 provinces and visit all of 3 different districts and engage with our community, sharing information. We thank them for where we are. You know, I've got colleagues that's from the UK, and they speak with great loft of why it's important to show generosity, that the national health insurance with those that have and those that don't have, it's almost like a solidarity fund. It's working in many countries. The UK is a classical example where you don't have this. If you're rich, you will have good health, but if you're poor, you're just going to die in a queue somewhere. So thank you, Comrade Dr. Kenny Jacobs. Stay safe, and thanks for the hard work. And to all the listeners out there, this has been a podcast with myself, Faiz Jacobs, on the People and Politics podcast. Stay tuned. We're going to get more topical issues, and part of this is to empower, to inform, and to educate our people so that we can make informed decisions. With that, thank you, Dr. Jacobs, and all the best. Stay warm, stay safe.
Thank you very much, and thanks for this opportunity. Thanks.